Zimbabwe's Minister of Health, Dr. Douglas Mombeshora, has outlined plans to double the health workforce by 2030 as part of plans to afford universal health coverage for all Zimbabweans.
Speaking during a tour of Engucheni Hospital in Bulawayo, Dr. Mombeshora emphasized the establishment of a health service commission or facilitate the necessary reforms to achieve this goal.
In actual fact, what we want is to increase the force. Because we have said we want to double our health workforce by 2030. And how do we double it? Increase training, recruitment, and retention. And the retention is a serious task. I know everyone here is not happy with what you are getting. If there's anyone who is happy here, that person maybe needs to be admitted here.
Dr. Mombeshora is in Bulawayo for a week-long strategic planning workshop for 2025 for the Ministry of Health. He also underscored the need to retain trained health professionals by improving working conditions in the sector.
We now have the Health Service Commission, and some of the tasks that we have given them is to see if we can have a separate grading system that applies to the health sector because of the nature of our work, so that the remuneration becomes better. We know the uniformed forces have got a different system which they use for their own commissions, like us. So if we have our own commission now, we should not be following the Public Service Commission grading system and so on, and remuneration.
That is incredible, doubling the workforce, the health sector. Actually, I think the health sector is something that's really important that we really need to keep our eye on and kind of enhance because, we need more trained people. We hear those stories of those bogus doctors that, you just go into a hospital and start being a doctor. Yeah. But, we just really do need to train more people in the health sector. I think it's very, very
But for me,
important.
I don't think it's really doubling. But it's really putting in the right numbers.
Yeah.
Because you look at the brain drain in the health sector. How many people have gone further afield to work, especially as social workers and all that. Mm-hmm. Most of them are trained nurses, trained doctors. Yeah. And we have had massive brain drain in this sector. So let's train more, like what the doc was saying at the end. We need more trained. In fact, we need to retain more trained professionals. Yeah. Because you look at how much they are going to the UK for example, and you look at what they are getting here. So it's all about improving the working conditions.
Improving the working conditions.
Yeah, if they do that, they'll be able to return, or because we've got a super training schools here, and it's really practical.
Yeah, I think you are right in saying we are well trained. Yes. We're educated well enough in this sector, but it's about the conditions that come
exactly.
thereafter.
Improve
and the working. There's a lot of work that is done in the health sector, but it's just improving the conditions, the salaries, the way of living for some of the professionals.
Yes, exactly. And they would not
need to go anyway. Yeah. And then
because
we keep that.
Look at how how they will be alienated from their family members, for example, because you see a lot of dysfunctioning families. The wife has gone, or the husband has gone, and imagine you as young as you are.
Yes, thank you, sir.
You go stay in the UK, your husband stays here.
That's
3 years and what. So because whatever you'll be getting there, for you to be commuting between Harare and London, for example, it won't be enough.
Yeah, you are absolutely right.
Konapo, ipapo, ba ZTN Prime, DSTV channel 294, the place to be.